I just want to thank you, Mr. Casper, for taking the time to meet with me this afternoon. And I wanted to congratulate you on your recent victory in your election for a Republican seat in the House of Representatives for District 54. So I wanted to meet with you today because when I was researching you during your election, one of your platforms was keeping Fort Hood strong. And I think part of that is addressing the mental health needs of our community. Are you aware that there are over 1 million veterans that live in the state of Texas?
Yes, I am.
And are you aware that every 22 seconds, one of those veterans or active duty military men or women take their own life? So House Bill 19 is a House bill that you will be hearing about in much depth when you go to session in the upcoming year. And it is that bill that would fund or add additional funding to mental health services here, not just locally, but in the state of Texas. Currently, we do not have enough providers to provide care to meet the needs of our community. In addition to that, those that do provide care are the burden of the number of volume of patients that they need to see is overwhelming. This bill would help fund additional education for providers that was to specialize in behavioral health or mental health care. In addition to that, it would provide increased reimbursement for such payers as Medicare and Medicaid. This is something that is vitally needed in our community. Our emergency rooms are overwhelmed with behavioral health patients. I am a healthcare provider, and we see and hold patients sometimes for days waiting for acute care beds. And this funding will allow for education for primary care providers as well as those specialists for those acute care needs. I would really like to implore you to fight for this. I know that there is some concern that there will be budget shortfalls due to the price of oil falling, and I cannot tell you how much this would help our community. Can I count on your support when this bill comes before legislation? Thank you for your time.